We ready now? All right. When we look at the upper extremity, we're looking at three bones, right? We're looking at the bone in the front. That's the clavicle. We're looking at the bone in the back. That's the scapula. And then we're going to look at the upper extremity, which is the humerus, radius, ulna, and then the hands. All right? So, on the clavicle, there are three things that you have to know. Number one, you have to know that the name is clavicle. The clavicle sits like this. So one end, which is the thicker end, articulates with the sternum, so this is the sternal end of the clavicle. The other end, which is flattened, articulates with the acromion process of the scapula. So it's called the acromial end. All right, so that's the clavicle. We look at the scapula. This one will be on the right-hand side. I'm going to turn them around so you can see. But we have this big line that runs here. This is called the spine of the scapula. The spine of the scapula flattens to a process at the end called the acromion process. If I go back to the spine, we have this depression underneath. Muscles sit up in that depression. This is called the infraspinous fossa. We have a depression above as well. So since it's above the spine, it's the supraspinous fossa. All right. If I spin them around, there's our acromion process again. This one is called the coracoid process. And then we have the glenoid cavity. The glenoid cavity is where the upper arm, or the humerus, articulates, right, to form the shoulder joint. If we're looking at it, we do have two borders that you have to know. This side is closest to the armpit, so therefore that is the axillary border. You can also call it the lateral border if you like. This one is closest to the spine, so it is the vertebral border. You can also call it the medial border if you like. All right, so that's the scapula, that's the clavicle. Now we look at the humerus, right? Humerus is the top bone, or the one up in the arm. We can see the rounded part, that is the head of the humerus. Again, we know the head always articulates it. The other thing is the head is always medial. So when I get down here to the epicondyles, if you look, if it's on the same side as the head, that is the medial epicondyle. If I'm pointing to the other epicondyle, then that obviously would be the lateral epicondyle. But let's go back up to the head for a minute. All right, so that's the head of the humerus. We can see that we have two bumps. There's a bigger bump and a smaller bump. The bigger bump is the greater tubercle. The smaller bump is the lesser tubercle. See that we have this little groove in between? That is called the intertubercle groove. On the lateral aspect of the humerus, we do have a ridge here. That is called the deltoid tuberosity. Why? Because the deltoid muscle attaches there. Right? The abducts or abducts the arm. If we slide down to the distal end of the humerus, again, we have the part that flares there and the part that flares there. This one is the flaring is the epicondyle. If it's on the same side as the head, then it's the medial epicondyle. If it's on the other side, then it's the lateral epicondyle. On the same side, we have these two bumps here. The bump that's medial is called the trochlea. The bump that is lateral is called the capitulum. All right, so that's the humerus. If we look down and look at the two bones that make up the forearm, we know that we have the radius, we know that we have the ulna. How do we know which is which?
Radius closer to the body.
Again, if we're in anatomical position, right, the ulna is always on the pinky side. So I always remember PU, right? So pinky, ulna, radius, the thumb, radius. How do I know which one's the pinky versus the thumb?
Or pinky small.
Think about joints, right? Thumb only has two, pinky has three. So if I'm looking at the pinky, it's got three bones in here, or three phalanges. The thumb only has two. All right? So if for some reason I take them apart and they're just sitting by themselves or something up on the desk. So, just throwing that out there. So if we look at the radius, why? Because this is the thumb. The flattened part up here that articulates at the elbow, that is the head of the radius. If we look at this little bump here, that's the radial tuberosity. Okay? Bicep comes down and attaches. If we slide down to the distal end and we look at it, see the little bump on the radius? That is called the styloid process. All right? And that's all you have to know on the radius. If we look at the ulna, now what you have to know is, see the flat end of the ulna? That's the head of the ulna. But where does it articulate? It's down at the wrist, not at the elbow. All right, so that would be like one of those written testable questions I would ask you. The head of the ulna articulates where? Elbow, wrist, that kind of thing. The only other two structures, did I say styloid process?
No.
The ulna has a styloid process as well. All right, so that little bumps the styloid process. There's also a test question, what three bones have a styloid process? Ulna, radius, and
Skull.
specifically?
The occipital.
Close, but this one
Temporal.
comes off the
Temporal.
temporal, right? So, those would be kind of written test questions. Now, if we look at the elbow itself, can you guys see that it makes a C down here? Kind of goes around. So this part here, right, is your elbow. The part that you feel is your elbow is the olecranon process. All right? But the bottom part of the C, which is down here, that is called the coronoid process. We have another coronoid process. Where is that?
What corner?
That was on the mandible, right? So you'll see some test questions like that when we have some common bones. The olecranon, right? So that's the olecranon, which if you feel on your elbow, the big spot sticking off, right? So that's that one. But then underneath that, we do have the C, and that is the coronoid process. If we slide down, then we just have the hand left. Bones of the wrist are called the, remember you guys heard of carpal tunnel syndrome, right? So these are the carpal bones that make up the wrist. Do they have their individual names? Yes. Do we have to know them? No. Just tell me that they're carpal bones. These bones here make up the palm of the hand, right? So these are the metacarpals. And then the fingers are known as the phalanges. But since we do have three phalanges, you have to know that this is the proximal phalange. Why? Because it's closest to the point of attachment, right? That's the middle phalange. That would be the distal phalange. If I'm looking at the thumb, which one is missing?
The middle.
So we have the proximal, we have the distal, the middle phalange is missing. All right, that's it. So it's a nice, easy one.
Yay.
That's it, Dad.
Are you going to say goodbye?
Nice, easy one. Bye.